So I get a lot of questions specifically about GP training from the perspective of an international medical graduate. What are the requirements? How does it all work? And so on. Where does MRCGP fit in? So I just wanted to highlight some of these things and hopefully dispel a few myths. So the first thing is, to be eligible to apply for GP training, you need to have 2 years postgraduate experience after you finish your medical school. So you've got MBBS or MBBCH, you need 2 years of clinical experience after that, okay, before you start. As well as that, you need to have evidence of foundation year 2 competencies. So for most international graduates, because you won't have been part of an official foundation program in the UK, what that means is completing something called the alternative certificate. So one of your consultants that you've worked for at least 3 months within the last 3 years before you're going to start could complete this, and you have to get all of the criteria signed off. Okay. Once you meet that basic eligible criteria and you're eligible for full GMC registration, so that means if you have to do PLAB, you've done both parts of PLAB, then all that matters in terms of your chance of getting in is how you do in the assessments. So there are 2 assessments. The first is the specialty recruitment assessment. Okay, this is a 2-part exam. There's a clinical paper and there's a professional dilemma paper, which consists of situational judgment test questions. Okay, and you can see here the number of questions in each paper. Now, if you do really well in this paper, so if you're in the top sort of 10% or so in the country, then you can actually get a direct offer. Most people will have to move on, if they pass the specialty recruitment assessment, to the stage 3 selection center. This is a 4-part assessment, and it has 3 different simulated consultations, one with a patient, one with a relative or a carer, one with a colleague, and then a written essay type paper, a written prioritization exercise. Okay, so these are going to assess you against 4 domains: empathy and sensitivity, communication skills, conceptual thinking and problem solving, and professional integrity. Clinical knowledge is not assessed at stage 3. Of course, it is assessed in the clinical paper at stage 2, or the specialty recruitment assessment. So now, if you do well in stage 3 as well as stage 2, your scores are used from both papers, both assessments, to decide your overall ranking. Then you're going to be made an offer. Once you've got an offer, the GP training itself is 3 years if done full-time. And within that 3 years, usually you'll have about 18 months in hospital doing different rotations and 18 months within GP setting, so within a GP practice. You can only do MRCGP UK while you're within a GP training program. So there's 3 parts to it. So there is workplace-based assessment. So this is a series of assessments and things that you have to do while you're in your training, both in hospital jobs and in your GP practices. And there's a certain number, a minimum, that you need to get each year to be allowed to progress to the next year of training. So, at the end of ST1, ST2, and then at the end of ST3 to actually complete training. There's the Applied Knowledge Test, the AKT. This is a theory-based paper testing your ability to apply knowledge to UK general practice. It's 80% clinical, 10% evidence-based practice, so statistics, research methods, types of charts and graph, and 10% organizational, so medical legal issues, administrative things, practice management, these kinds of things. You can sit this in your ST2 year or later. And then finally, there is the Clinical Skills Assessment, the CSA. You can only sit this in your ST3 year or later, i.e. your final year of training. This is a simulated surgery consisting of 13 different patients or simulated patients, and in each one you're going to be assessed on your ability to take a history, examine, work out a diagnosis, manage, as well as communication skills. So this is testing the whole package, that you've got the knowledge and skills to be able to go and practice independently. Okay, so that's the process. You've got 2 assessments to get into GP training. Once you're in training, there are 3 years of training and then 3 types of assessment within it. The workplace-based assessment, which happens throughout the whole 3 years, the AKT, which you can sit in the 2nd or 3rd year, and the clinical skills assessment, which you sit in the 3rd year. Once you've passed all of these, as well as met some of the other requirements, that will give you a certificate of completion in training, and you'll be eligible for membership of the Royal College of General Practitioners. And once you've done all of this, then you can join the GP register and practice independently as a GP. So you could work as a GP partner, a salaried GP, a locum GP, portfolio GP. There's lots of options open to you. So that's the process to apply and get into GP training. And then once you're in, to actually get through GP training and qualify as a GP. And if you are interested in becoming a GP, I hope this has been useful, and I hope to see you and meet you at some point throughout that journey, and all the best. Thank you so much.